Today, we're going to be talking about non-unions. Hey guys, it's me, Dr. Nooreen, your resident financial specialist, and welcome back to my channel. So you guys, today we're going to be talking about a non-union because I am here to answer your questions, and I had someone ask me in my comments in another video, what's a non-union? Can I talk about non-union? So here's that video. Let's get right into it. So you guys, what is a non-union? A non-union is basically when two pieces of bone are trying to heal together, but they just don't. They don't succeed in healing together. This could be in a situation with a fracture where two pieces of those bones are trying to heal together. It can also happen when you're having surgery and you're trying to fuse two joints together. So basically, when bones are trying to heal together and they are unsuccessful in doing so, it then creates a non-union. Okay guys, so what does bone need to heal? What allows bones to heal together? There's a couple of factors. The first factor is stability. When bones are healing together, they're given stability in one of two ways. Either by hardware that's placed across the bone pieces that are trying to heal together, or with a cast. Both internal hardware and a cast give those bones stability to heal together. And the type of stability you're going to get is going to be up to your physician, because some fractures or broken bones require hardware, some don't. Some you can put a cast on and they should heal together just fine. The next thing your bones need to heal together is good blood supply. Good blood flow to the bones that are trying to heal. It brings in the factors that bone needs to heal, which are oxygen, growth factors, and healing cells. You also need good nutrition. Bone needs good nutrition to heal together. So eating a diet that is high in vitamin D, calcium, protein, all of that will help your bones heal together. Okay, so what causes a non-union? Basically, a non-union can occur when those things I just mentioned aren't present. So if you don't have enough stability, if you don't have good blood supply, and if you don't have good nutrition, those could lead to you developing a non-union. Now, in addition, there's also risk factors that will increase your chances of getting a non-union. Those risk factors include, but are not limited to, the following: the use of tobacco or nicotine, older age, severe anemia, diabetes, low levels of calcium or vitamin D, infection, or a complicated break that is open or comminuted. So what are some symptoms of a non-union? So the symptoms of a non-union is having pain at that fracture site long after you had that initial fracture or that initial surgery where you're trying to fuse two joints together. So you guys, how do you treat a non-union? So there's surgical ways and non-surgical ways. To treat a non-union non-surgically, basically you can use something called a bone stimulator, which sends ultrasonic or pulse electromagnetic waves that stimulates healing. And in order for this to be successful, you have to do it continuously, and you have to do it for at least 20 minutes a day. There's a lot more detail that goes into it that I'm not going to get into in this video. So you guys, for surgical treatment for non-unions, you basically kind of redo the surgery. You go back in, you freshen up the two bone ends, and you can use a bone graft. The bone graft can either be an autograft or an allograft. An autograft means that it's coming from you, so it's going to come from somewhere else on your body. One of the sites that's often used is your iliac crest, or an allograft, which will be bone donated from a cadaver. The other thing you can do is you can add bone graft substitutes or osteobiologics. The other thing you can do when you go back into surgery is you can add more stability by increasing your internal fixation, so making your internal fixation more robust than what it was previously if you did use internal fixation previously. And the other thing you can also add on is external fixation. You can increase your stability by using a combination of internal and external fixation. It's all situation dependent, patient dependent, and fracture dependent. Okay guys, so that was a very brief overview of non-unions. If you guys have more questions about non-unions, or if you want me to do topics like this where I get very technical and very scientific, let me know. I can do that. I just kept this video very basic because it seems to be what people like, but if this is not what you like, let me know in the comment section down below. And you guys, as always, thank you so much for watching. Don't forget to stretch and subscribe, like this video, and I'll see you guys next week. Bye!